friends, welcome to CNS Viewpoint. Today we are going to talk about an important statement made by the World Health Organization Director General, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros had raised his deep concern, that on the declining rates of COVID testing around the world in several countries. So this is really very worrying, because we need to know where the virus is, in which communities it is spreading, to what level it is spreading. Is it the same variant or the other variant? There's so much of information which is so important and critical for disease surveillance, also for disease control. This is the basis. This provides the basis on which an effective disease control program can be designed and implemented. So knowing where the virus is, knowing your pandemic is so key, friends. And decline or reduction in number of countries of COVID testing is really very alarming. Already we have very sketchy or capacity for genome sequencing, which tells us about the variant, etc. So we really should not reduce testing. We should rather increase testing, or at least maintain enough testing in a scientific manner, so that we have our fingers on the pulse of the pandemic, and we can know early enough of where the new possible waves could emerge, or new variants could emerge, etc., and come up with effective messaging and effective programs to control it and contain it. And we have seen the cost. We have paid the price of not knowing enough, or not knowing early enough about the variants, and which led to so much of human suffering and unnecessary deaths. So Dr. Tedros Adhanom Ghebreyesus, the Director General of WHO, had also released the guidelines of the new guidance of WHO on self-tests. CNS was a law. He had joined forces with over 100 organizations worldwide, demanding that WHO takes cognizance of self-tests and issues guidance. So that has happened, friends. Dr. Tedros also said that 5 rapid antigen tests, self-tests, have been already given a green light for emergency use authorization. Let us hope these self-tests are used in tandem with the existing evidence-based ways of testing for COVID-19, including RT-PCR, and increase access of testing for all. And because most of the testing has happened in the richer parts of the world, or the richer communities, if you look at poorer or middle-income countries. So let us hope that accessibility to COVID testing shoots up. We do not reduce testing, at least as of now. We have enough scientific ways of monitoring, where the disease is, where the virus is. So this is a hope. This is not happening currently. And with that, I will end today's CNS Viewpoint. And we'll be back again, like every day, at 5 p.m. India time tomorrow, with the thoughts and views and perspectives on something that made us think. Bye till then. Take care.